Associate Professor Dr. Azrianti Anwar Zaini, and I'm the consultant endocrinologist and consultant pediatrician in University Malaya Medical Center. In this video, I will share about how we diagnose children with Turner syndrome and how parents can help to get an early diagnosis as well as early intervention for children with Turner syndrome. If a baby is diagnosed or suspected to have features of Turner syndrome, like for example, pitting nails, they can also have pitting edema of their lower limbs, meaning that they have some sort of swelling over their lower limbs. If a baby has wet neck, wet lungs, and also cardiac abnormality, means they have some abnormal heart formation, doctors will send blood tests to look at their karyotype to confirm Turner syndrome. So in another circumstances, when a pregnant mother is at higher risk, or when the doctor is suspecting that the baby that is carried by the mother has Turner syndrome, so a specific test called amniocentesis might be done for the mother to look for the karyotype or to assess the possibility of having a baby with Turner syndrome. Having said that, once the baby is born, the baby's blood test is still needed to confirm the diagnosis of Turner syndrome. Secondly, when a child comes to see a doctor at around the mid-childhood years, around 7 to 10 years old, with a concern of short stature. So all girls with short stature are required to undergo blood testing to confirm the karyotype to detect Turner syndrome. There are also children who comes in a little bit later, at around after the age of 12 years old. During this time, most of the children presents with primary amenorrhea or failure to achieve or attain their menarche. And during this time, these children might be referred directly to the obstetric and gynecologist. And at that point of time, they are also being referred back to the pediatric endocrinologist because we need to confirm and also diagnose them with Turner syndrome. So if a parent is concerned about their child's growth and comparing their heights with their peers, and if you notice that your child is not growing as much as compared to their friends in school or even family members, I think this is the right time for you to go and see your pediatrician and talk about further assessment. Many girls were brought slightly later for attention, especially when it comes to their abnormal in pubertal development or abnormal in their periods, getting their periods on time. I would suggest parents to bring in their children, their girls earlier, should they not see any pubertal development after the age of 10 years old, and if they have no periods by the time they are 12. It is very important for you to sit down with your pediatrician to see if there's any issues in regards to their pubertal development. To help parents to track their children's growth, there are a few ways that you can do this at home. Number one, you can continue to monitor your child and measure your child at home. And if possible, if you have the growth chart, sometimes you can get this from your pediatrician. You can plot the chart at home and then you can see if your child is growing well. There are other modern technologies that you can use, like the Growth Journey app, to track your child's growth at home. If your child has been diagnosed with Turner syndrome, I think it is very important for you to continue to follow up with your pediatrician, and your pediatrician would give you recommendations and referral to the specific medical specialist for the medical attention that is required. So in summary, I think it is very important to diagnose Turner syndrome early. The earlier the diagnosis, the earlier the intervention that we can help, and the better prognosis for these children, these young children with Turner syndrome, as well as young women with Turner syndrome. If you want to know more about understanding young children and people with Turner syndrome, University Malaya Medical Center has already published a book, a very colourful and interactive as well as engaging book for children as well as parents to read, and hopefully you can gain a little bit more information about young people with Turner syndrome. Please click on the link below if you need to get a copy of this.